Good morning, everybody, and thank you, everybody, for joining us here today. It's a beautiful, sunny spring day. My name's Scott McElfresh. I'm the Region Director with CVS Health. We're particularly pleased today to host our friends from the Westchester County Board of Legislators to discuss the importance of National Drug Take-Back Day in our collective effort to help address this country's opioid epidemic. CVS Health shares the board's commitment to addressing this public health challenge, from raising awareness about safe medication disposal to educating young people about the dangers of prescription drug abuse and increasing access to life-saving overdose reversal medications. CVS Health is fully committed to help to end the opioid abuse crisis in this country. Since 2014, we have been working with local communities to provide opportunities for patients to safely dispose of unwanted medication at more than 950 police departments across the nation, including the donation of 99 medication disposal units to law enforcement across the state of New York. And we've begun installing safe medication disposal units, kiosks, in select CVS's. In fact, last year, this very store became one of 50 CVS pharmacies across the state of New York where customers can now dispose of unwanted medications every day. Through this nationwide effort, we have collected and disposed of more than 324 metric tons, or 715,000 pounds of unwanted medication from across the country, and 81,000 pounds right here in the state of New York. This is medication that could be diverted, misused, or end up in the water supply. Our safe medication disposal programs is just one of many of our prevention-focused initiatives. Another example is our Pharmacist Teach program. Through this program, pharmacists speak to students at local schools about the dangers of prescription drug abuse. Here in New York, we've reached 30,000 students and parents with this important message. We're very proud of the work we're doing to build healthier communities and are dedicated to continuing our work to help fight this epidemic in New York and nationwide. But we can't do it alone. It will require public and private partnerships and a multi-pronged effort to make meaningful impact on this public health challenge. In 4 days, April 27th, it will be National Drug Take-Back Day, which aims to provide safe, convenient, and responsible way to dispose of unused or expired prescription drug. I know proper drug disposal programs and programs that help people that abuse and misuse prescription drugs are equally as important to the Westchester County Board of Legislators, which is why I'd like to now introduce the County Executive, George Latimer. Mr. Latimer.
Thank you, Scott.
Thank you.
Thank you very much.
As Scott pointed out, it is a partnership between lots of different entities in order to make this program and all the other programs work together. In a few minutes, you're going to hear from two of our key executives within the administration, our Commissioner of Health, Dr. Charlita Amler, and our Commissioner of Community Mental Health, Michael Orth. And both of them run departments that are actively involved in dealing with the impact of drug addiction, and particularly that which generates out of prescription drugs. What's particularly important today is to emphasize two things. Number one, there's tremendous corporate responsibility that's been shown by CVS. And CVS's presence across Westchester County is unrivaled. In every nook and cranny of this county, this corporation has a presence, and this corporation has taken on a corporate responsibility in this area that is to be appreciated and welcomed here in White Plains and elsewhere in the county. So that corporate responsibility is one of the backdrops of today's message. The other message is the effort and work that went into this by the Westchester County Board of Legislators. Now, I'm in the executive branch, they're the legislative branch, and this is our branch complementing the legislative branch for taking an initiative in this area. Ultimately, what happened was legislation by the state of New York. So our state legislators, state senators, state assembly members did the right thing. And anytime you can do something on a statewide basis, that's superior to doing it in a smaller basis. But back in 2014, Mary Jane Shimsky, Ben Boykin, a number of my colleagues behind me here took the leadership on this and started to craft legislation on a county basis that would make this more possible. Because if you go back a number of years, it was only available to drop off at a police station. And while there are police stations in every community, there's a lot more CVS's in every community. And there's also a different feeling you get when you go to shop and purchase things as you normally would during the day and can turn in your medicines, as opposed to making a special trip to the police station, which can for some people be intimidating. So again, corporate responsibility today the role of this legislative body in taking leadership in this area, and then also the community side of this. I see friends of mine, Nancy Pasquale from Rye and others, that have been involved in community education to help people understand what this is. Those things come together to make for an effective policy. So we're happy to be part of this today. Scott, we'll turn it back to you.
All right. Well, thank you. And thank you to the board, obviously, for joining us here and all you do to help make our communities safe. As we know all too well, the opioid crisis is a very complicated problem. It didn't begin overnight. It won't be solved overnight. It started more than 20 years ago. And in the last 2 decades, opioid prescribing rates have tripled, and deaths due to drug overdoses have reached approximately 60,000 annually. These are pretty sobering statistics. But through the collaboration of public-private partnerships like the one we enjoy with the Westchester County Board of Legislators, we're making an impact. And at CVS Health, we're dedicated to continuing our work to help fight the opioid crisis here in New York and nationwide. So thank you again for joining us here today, and I guess we'll open up to the group for questions if there are any.
I think we have other speakers.
Oh, okay. By all means. Oh, sure.
Thanks, Scott, and thank you, County Executive Latimer. I'm Ben Boykin, Chairman of the County Board of Legislators, and I'm very pleased to be here with CVS this morning and with a take-back box where you can drop off unused and expired prescriptions and you don't have to go to a police station. I'm joined by several of my colleagues from the County Board of Legislators, starting with Majority Whip Mary Jane Shimsky. We have Legislator Nancy Koval, Legislator Nancy Kitley Koval, Legislator Nancy Barr, Vice Chair Elfrida Williams, Legislator Damon Marr, Legislator Catherine Borgia, Majority Leader Catherine Parker, and Legislator David Tuviello. So I'm very pleased that they've joined us here today, and you'll be hearing from several of the legislators shortly as we go through this. I joined the Board of Legislators in 2014, and one of my first contacts with my constituents was done through an e-news, and that e-news gave places that you could drop off unexpired and unused prescriptions in police stations at that point in time. And I did that because a constituent came to me and says, I've got all this expired medication, I don't know what to do with it. So I've been really at the forefront of doing this and working with trying to get unused prescription drugs to be able to be taken back at police stations and now at places like CVS. As you know, this is a tremendous public health issue, and as we're dealing with the opioid crisis, it's very appropriate that we have places that we can drop these drugs off. And it's important that we continue to get the information out there, because so many people do not know that you can come to CVS, shop, and drop off your prescriptions. So we're going to continue to get that information out so that people will know that CVS has partnered for a place that we can do this. And as you will also be hearing from our commissioners of mental health and our commissioner of health this morning about the issues related to this. This is a public health issue. It is a social health issue. And with that, I'm going to turn it over to our Majority Whip, Mary Jane Shimsky.
Thank you very much, Ben. Having every day become Drug Take Back Day is very important to protect our environment and the public health. The Board of Legislators has been working on this issue since 2013. The colleagues behind me who are already working on this at that time include legislators Elfrida Williams, Catherine Borgia was here at the time as well. There was legislation introduced to require institutional users, including hospitals and nursing homes, to come up with a pharmaceutical take-back plan so unused medications would not end up getting flushed down the toilet. Legislator Nancy Barr, who will be talking to us later, will talk a little bit about the environmental consequences of introducing all of those prescription drugs into our environment. Unfortunately, that legislation did not go anywhere that term. But what happened in the interim was the opioid crisis had really taken on epidemic proportions. And according to the Centers for Disease Control, as many as 70% of those who are addicted to those drugs got either their start or some of their drugs as they were continuing down the path of addiction from friends and family members' medicine cabinets. So it's clear that something had to be done. It was time to revisit the whole concept of pharmaceutical take-back, but this time also focus on the everyday consumer to make sure that we were not keeping potentially dangerous drugs in the reach of people's children, grandchildren, and other people who use their homes who might actually have a substance abuse problem. Now, each day, 3,900 people initiate non-medical use of prescription opioids for the first time. That's according to a study reported in a Prescription for Action, which was a study on pharmaceutical take-back, which was instituted in 2016. Now, what happens if people keep going down the path to addiction? Things don't end well. In 2015 alone, 107 Westchester residents died from overdoses. And according to the county medical examiner's report, one family of drugs, opioids and opiates, were the cause of 83% of these deaths. And as I said, 7 out of 10 either get their start or get a lot of their medication from other people's medicine cabinets. Now, in 2017, the Board of Legislators started working out on legislation I sponsored to make some requirements for chain pharmacies like CVS to start taking back medication on a regular basis. At that point, the state legislature was also taking up a bill. That bill passed in 2017, but the product stewardship advocates who were looking to get some really effective pharmaceutical take-back legislation passed were not happy with that particular bill. The Board of Legislators actually sent a letter urging Governor Cuomo to veto that particular law, and veto it he did. In 2018, we finally got a more effective law. The initial law was actually allowed pharmacies to charge people when they brought back medication. This bill actually requires all pharmacies with 10 or more establishments in New York State and all pharmacies that provide prescription drugs by mail to New York residents to provide take-back methods free of charge for their customers. This bill will probably begin to take effect in late summer, early fall, as drug manufacturers have until July to submit plans for consumer pharmaceutical take-back to the state. This bill is very closely aligned with one of the bills that the Board of Legislators was planning to pass if the state did not act. But we're very happy that the state did act. This is a great program which will be implemented consistently, not just in Westchester County, but across the 62 counties and New York City in New York State. What we really need to do, and this is something that Dr. Amler is going to focus on when she comes forward, is we need to make every day pharmaceutical take-back day. Sometimes we've all seen it in our families. We've also seen it probably on sitcoms and movies about family life. The medicine cabinet that when you open it up and all these pill bottles fall out. Unfortunately, it's become no joke. People are feeding their addictions through those medicine cabinets and people are dying. We have to make it as easy as possible for people to promptly dispose of their medicines when they no longer need them. And we thank CVS for their leadership. We'll be taking a look at the disposal box later. We look forward to the day when there are disposal boxes very close to every resident of Westchester County. So with that, I'm going to turn it over to the chair of our Environment, Health, and Energy Committee, Legislator Nancy Barr, who will be talking more about the greater environmental imperatives for this law.
Thank you, Mary Jane, and thank you to CVS for being out ahead of the curve on this one. Obviously, when the New York law goes into effect, it will be required, but I think it's notable that CVS has already gotten out there and is providing these give back boxes in their stores. And we just heard a lot about the health benefits of bringing your unused drugs back, but there's also a big environmental impact, which ultimately is also a health impact, and that is for our drinking water. And I don't know if you experienced this when you were growing up, but it was pretty common for people to just flush their unused drugs down the toilet, thinking, okay, well, you know, that's a safe way to dispose of them. But while it might keep people from using them, it certainly doesn't keep it out of our water supply. And, you know, we actually now have some studies and statistics that show that when you do something like flush them down the toilet or throw them down the drain, they end up in the drinking water supply. And I'm just going to cite a couple of statistics as examples. From 2012 to 2014, scientists from the EPA and the U.S. Geological Survey collected water samples from streams across the country and tested for the presence of more than 700 human-sourced contaminants. Their survey found the presence of more than 400 such contaminants, including more than 200 drugs and poisons. Antidepressants discharged from an Iowa wastewater treatment plant were found in the brains of fish miles away. The Associated Press reported on painkillers and antibiotics and mood stabilizers in 24 metropolitan water supplies. And a study of our very own Hudson River, published last year by researchers from Columbia University's Lamont Doherty Earth Observatory, found antibiotics, cholesterol and blood pressure meds, acetaminophen, and a dozen more common medical compounds in the river. So, you know, anybody who thinks that by flushing them down the toilet or throwing them down the drain, you've disposed of them in a safe manner, it's simply not true. These do end up in our waterways. Fish eat them. We eat the fish. It ends up in our, could end up in our drinking water as well. So it's really, really important from many different standpoints, health standpoints and environmental standpoints, that we dispose of these drugs properly, and programs like the Take Back program you have here at CVS, as well as the ones we have in the police departments and efforts made around the county, are all really important to prevent this from becoming an even bigger problem. So thank you very much. And I think now you'll hear from Kitley Colville, my colleague, who is the chair of the Social Services Committee.
Thank you very much. As chair of the Social Services Committee, we know that many of the people that have reached into their medicine cabinet ultimately are using them and their parents of young children. So in the social services world, they often are finding that they are investigating Child Protective Services reports because the parents are self-medicating. And that is a very difficult and expensive social cost. And this is an easy fix. Not that addiction is an easy fix, but preventing it in the beginning. I think CVS Health is literally embracing the health of our community and our residents, but we all can. And I did it this morning. So I have an exhibit. Exhibit A. Today is National Take Back Day in my household. So it could not be easier. You walk over here, you put it in here, and the opioid, somebody in my household was given because of a tooth problem, it's gone. So I urge everyone to consider doing that, and in particular because I see it as a Committee of Social Services chair, just how difficult and how much trouble it is for families when they get started down that path. Thank you very much. I'm supposed to introduce somebody. You? Okay, sorry. And now, Commissioner of Health, who really has the statistics on this.
But I don't think I'm going to be talking statistics today. So I'm pleased to be here today to promote the safe medication disposable options that we have available here in Westchester, along with other strategies to help prevent the misuse of opioids. The secure disposal of medication is essential. That's why Westchester has been a leader in placing medication drop boxes throughout the county, where residents can rid their medicine cabinets of unused and expired drugs. In fact, in every municipality in Westchester, there's currently one drop box in every community. These drop boxes have many benefits. They are free to use, they are anonymous, and they are secure. The majority are available to accept medications 24 hours, 7 days a week. And the medications that are collected in them are ultimately incinerated, preventing the drugs from ending up in our water supply. As we just heard, that's something we'd like to avoid, as well as unwanted hands. Most of Westchester's drop boxes are located in municipal police stations. That was because at the time they were put there, that was the only place the law would allow. But our main county office building and some pharmacies, like here at CVS in White Plains, and also Northern Westchester Hospital, have boxes as well. To find a drop box near you, please visit the Health Department's website at www.westchestergov.com/health. And another option Westchester residents have is to bring their medications to the County Household Materials Recovery Facility in Valhalla. All prescriptions and over-the-counter medications are accepted once a month by appointment, and residents can simply drive up and drop them off without even having to leave their car. Information about the Household Materials Recovery Facility can also be found on our website. In addition to safe medication disposal, we are also working to combat opioid deaths by providing the life-saving drug Narcan. Many of you may not realize, but more people actually die from opioid overdoses now than from automobile accidents every day in this country. And I think that's a pretty sobering number. In 2014, we began working to get Narcan into the hands of first responders. In 2017, to save more lives, we extended Narcan training to the public. As a result, more than 1,000 police officers, because frequently they're the first person on the scene, and more than 4,200 community members have been trained to administer Narcan. Many of the public that we train are actually families or parents of individuals who have opioid use disorder. And really, they came to us saying, my greatest fear is that I will find my loved one dead at home from an overdose, and I want to be able to do something to prevent that. Narcan is their best hope. So we're happy to have trained so many people in Westchester. We are also working to raise awareness and provide education within the medical community to get ahead of the problem, to go to the source, so to speak, by reducing both the demand for and the prescribing of opioids. My department delivers Narcan training to medical, dental, and nursing students. And at these trainings, we discuss pain relief alternatives to prescribing opioids and ways that medical providers can identify the potential for addiction in their patients and help them get available treatment resources. And lastly, I'd like to also mention that our health department is the current recipient of a $75,000 New York State opioid crisis grant. And with these funds, we are partnering with the drug treatment programs and Westchester County Department of Mental Health to improve linkage to care, increase access to Narcan for high-risk populations, engage local providers to improve the availability of medication assistance treatments for those with opioid use disorder, and to enhance syndromic surveillance efforts around drug activities. With the help of partners like CVS and Northern Westchester Hospital, who are making drop boxes available to the public, we are making strides toward ending the misuse of opioids. We encourage other pharmacies, other hospitals, and facilities with the capacity to house a medication drop box to do so, and to join us in our efforts. And together, we all really can make a difference, and we can save lives. Thank you.
Good afternoon. My name is Michael Orth, and I serve as the Commissioner of Westchester County Department of Community Mental Health. And I first want to thank the leadership and support of our county executive, the Board of Legislators, and CVS for their support in this important public health crisis. Westchester County Department of Community Mental Health, in partnership with other county departments and organizations, have been providing awareness and training on the pathways to substance misuse and opiate addiction. This includes providing training to students, to college students, to seniors, to physicians, everyone who's involved with the health and well-being of our citizens. So we've been going out providing education, support, and really understanding the underlying mental health and addiction issues that impact many of the people we are talking about. It's also important to know that there's help out there if someone is struggling with addiction. Westchester County Department of Community Mental Health has outreach workers, treatment programs that are available for people. We are proud to announce we have a new 24-hour hotline. Treatment Connect hotline. The number is 1-833-515-HOPE. That's 1-833-515-4673, which is a new 24-hour, 7-day-a-week hotline that family members, loved ones, or individuals can call to get the important support and treatment that they need. Also available at our department, 995-5225, for additional support and resources. Part of the continuum of services also includes having peers, outreach workers connect with people who may have concerns about their loved ones as well. So as Dr. Ambler said, this is about saving lives and all of us being hypervigilant and providing the support, education, and treatment that is so necessary and important. Thank you.
Okay, well, thank you, everybody, and thank you to the Westchester County Board of Legislators, the county executives, for all you do to help keep the community safe, your partnership here today. And with that, we'll open it up to any questions.
Can you guys just elaborate a little bit more on the educational opportunities as part of this initiative to help educate people with the abuse outcomes, and can you expand on that a bit?
So, when it comes to medical, we really want physicians to understand when they should prescribe an opioid, how it should be prescribed, at what point do you stop prescribing it, what are the triggers to stop, and what are the alternatives that maybe the patient could use instead of using the opioid. Because if that first prescription is never written, you might be able to prevent the long-term implications that end up with opioid use disorder. So it's really about educating people, and the best way to educate them is to start when they're new in their career, they're just learning. That's when there's a really teachable moment. It's sometimes difficult to teach professionals late in their career. So we're really out at the medical college, at New York Medical College. We're at Touro Dental School. We have been in New Rochelle School of Nursing. We've talked to hospital pharmacists. We will reach out to anyone, plus the public. And the public are a big part of our partners because they know if they have someone in their life that's impacted by this. And so my department treats them about Narcan, and then we tell them about how they can reach Michael's folks, who are then going to talk to them about what rehab opportunities are available within our community.
Yeah, we've also invested a lot of energy and time really doing prevention and awareness. We recently had a youth summit at our county center with over 400 high school students, and it's not only giving them the information but empowering them to go back to their high school and schools to really educate themselves and learn about the pathways, underlying mental health issues that often lead to addiction, and also just to have more awareness. We're also doing a lot of work with athletic directors, colleges who are often at the front line in recognizing there may be issues of abuse and addiction, and giving them the frontline knowledge to be able to intervene and help people.
And with the new grant that we got, Mike and I have staff that are actually going into communities that have high numbers of opioid overdoses and actually on the street talking to people about how they can get help, how, what is Narcan, how is it used, what are the recovery, rehab opportunities in the community at the street level, where people who have these problems are and really need that information.
Question?
Sure.
First of all, I want to thank CVS for taking such a proactive approach, because keeping drugs out of the hands of our youth is truly a protective factor. My question is, I know that CVS's pharmacy hours are different than their store hours. So the box is going to be available which way? Pharmacy hours or store hours?
Well, this particular location is 24 hours, so this box is accessible 24 hours. In stores where we do have differing hours, it is a requirement that the box is secured with the pharmacy. So the best thing for folks to do would be check their local pharmacy hours of operations where the kiosk is available.
Okay,
All right, you're welcome. All right. Well, thank you, everybody.
Thank you.
Thank you.
Thank you.